I was about 21 when I started noticing the thinning. My mom is a hairstylist. My whole family is a hairstylist. I have like an Italian family. So everyone has their own salon. Hair is like all we talk about and all they really care about. So I noticed like pretty soon when I started seeing it like a little, receding here and, in the back. Um, I didn't really do too much about it. My first steps was just kind of to ask as I was getting my hair cut, like, is there any products I should be using? And I think there were like a few shampoos that I started to use at first. I didn't really notice any difference, maybe just a little more volume, but didn't really change my hair loss progression. That was like the first step I took, and that's when I first noticed. It wasn't until a few years later where I did actual research about what was going on and made steps to figure it out. I was nervous to even come in for the consultation, even making the phone call, I was nervous. So I was kind of dreading the appointment, but at the same time, kind of excited to get answers. I was surprised with how easy Dr. Boden was to talk to about everything going on. Really was just kind of a time for me to get educated about what was happening and what can help. We talked about medications, um, and also possibly a transplant in the future. That wasn't really the first step for me. It seemed like there was things to try first. So that's where we started. He prescribed me a few medications to try. I was excited to start the medical therapy as soon as possible because I finally found something that could possibly help. So I did a topical minoxidil, and I also was doing the finasteride orally once a day. Um, and it was definitely helping. It took about 4 or 6 months for me to see any sort of improvement. Mostly it was in the back. It didn't really change, anything much in the front. I definitely saw an increased density in the back. And, Dr. Boden had a discussion with me one day as we were going to follow up again about how my medical therapy was going. And I kind of wanted to move forward with the procedure.
So we're here with Jeff, and this is the morning of your procedure. Welcome.
Thank you.
Glad to have a chance to work with you. We took a lot of time drawing in a hairline. We looked at the photos, we took pictures, but what I am always aiming to create is a natural appearance that frames the eyes. And we talked about this. We spent a half an hour drawing in a proper hairline that is going to stand the test of time when you get you through your 20s into your 50s into your 80s, and it will always look natural. And some people will say, well, isn't that a little receded? But my perspective is it has to look like a natural recession so that it will look natural over your lifetime. We're not trying to create a straight hairline because that doesn't look natural. Raise your eyebrows up real strong for a second. Your contour of your forehead was always naturally receded. You can relax. So that's what we're doing. So really what we're trying to do here is create an appearance of natural elongation. We're not trying to create a flat hairline. And if you turn, we're bringing the hairline down about a centimeter or two, but we're really strengthening throughout. That's what we're aiming to accomplish, bringing this hairline down to provide proper balance and to look natural over the course of your lifetime.
Question came up of FUE versus linear. It's super important to me to have flexibility to cut my hair however I want. I like doing a high and tight buzz cut, especially in the summer, and I didn't want to give that up. So that's why I went with FUE. Aesthetically, I would say I healed up in about a week. Anytime I had to go outside for any reason, I just threw on a baseball cap, which was super convenient. I did take a few days off. I took it easy for about 3 or 4 days. Didn't, do anything too active. And I started seeing results about 4 months later is when I initially saw the growth come in. And then I would say about 14 months is when I finally saw it slow down at its final peak. For me, the biggest difference after having the procedure done is that it's not in my head anymore. Every day before I went out for, dinner or work or meeting with friends, it was something that was always in my head. And I wore hats all the time. I think every time I hung out with my friends, I always wore like a backwards baseball cap. And now I don't have to think about that. I don't have that little noise in the back of my head that says, oh, fix this before you go out, or make sure this isn't showing before you go out. So that is number one for me.